Erin Muransky. I'm a registered and licensed occupational therapist, and I was diagnosed with bipolar disorder when I was 19. I have an unusual trajectory for my mental health because I actually was diagnosed when I was studying abroad in England. So poor parents of mine had to receive a lot of their education, and I was in an institution for a month when I was in England. It took a long time to kind of get me down from my mania so I could manage just kind of my day-to-day life. But I came back without medical bills. I had a month worth of medication I didn't have to pay for. So that was not a burden I took back with me, which most people do. And it did happen, so when I was hospitalized here in the States for a week, this time on the bottom end of things, so with my depression, I actually had bills. One of them was an ambulance bill, which was really stressful. Like, it's already stressful enough. You were just in the hospital, and now you're like looking down an ambulance bill. Which still, like, actually I like get bad reactions to ambulances as a result. But there are these things where it's already hard enough, so we need to not make it any harder. I often see when I talk about bipolar disorder or mental illness, I think about it a lot as somebody just gave you a dragon that you have to train without instructions, and they're not easy to train. So often you're in your 20s, still trying to get used to how do you get a job, do school, do laundry, things that seem like they should just be adult things. But now you have a dragon that won't let you do everything that you want to do because you're tired of taking care of it. You don't know how to do it. What do you feed it? What do you not feed it? There's all of these things that there's not clear, easy answers, and everyone's got a different one. So the little dragon that this person has versus the horribly vicious thing over here, like, nobody has a single answer for that because there isn't one. Everyone is different, and that's where I think that occupational therapy is really specially positioned because we're really good at figuring out what things work and what things don't. So a lot of my job, I work with older adults in Loveland at a program for all-inclusive care of the elderly. So it is all about experimenting. Is this something that's going to work for you? Does this make you less anxious? Does this make you more anxious? Is it better to, does this help you get your pants on? Does that save you energy so that you have more energy to do the things you care about, like taking care of your plants? So it's a lot of it's this give and take, and we're trying to figure out what works for people. And with older adults, they have been, I look at some of their charts and I see this could have been me. People that never had a support system, don't have a support system, were never actually treated. The people in my program can start at 55, which is about the time that the community mental health kind of deinstitutionalization process happened. So I have a lot of people with drug addiction because they didn't have anything else. There's just a lot of barriers for them because they've not had any guidance with these dragons that they're carrying around, and they're pretty destructive in their lives, and it's been that way for a while. So we run into a lot of cognitive deficits, cardiac issues, all sorts of stuff that is a result of this prolonged period of limited treatment and mental illness, which obviously is a challenge. And so, we're trying to use the resources and surround care. So we have 12 disciplines on our team, in-home nursing, primary care physicians, occupational therapists, I should be able to say my own profession, occupational therapists, physical therapists. We're all surrounding people trying to give them care. And even that's really difficult because I think we haven't always felt like we've been trained. I run into a lot of people that are just like, oh, well, that's not my job. I wasn't trained in that. I'm doing physical health. I'm the knee person. I'm the arm person. But we're all mental health professionals. And I think we need to be trained such and see our job in such a way. So I think that occupational therapy is a good fit for a lot of things that people need help with. So I throw that out there as something that actually isn't funded in an outpatient setting. I get it to do it because I'm in a program for all-inclusive care of the elderly, which is a rare animal and kind of confusing. So if you have questions, let me know. So occupational therapy, and I think just the other thing is, if there is a step you can eliminate to make it easier, eliminate that step. one less phone call, one less bill, one hard thing that is already hard enough. Like when getting pants on is hard, like you can't deal with like some of these other things. So anything that you can cut out of the way and make easier is going to be something that's going to keep somebody healthier, and hopefully not put them in a situation my participants are in, of prolonged kind of periods of having to deal with this. So that's all I got. Sorry.
Thank you.
Thank you so much.